What are some of the steps that we can put in place, or companies can put in place, or society or the government, to try to prevent both of these cases? Is more education necessary? Is some form of regulation necessary? Right now, it's still sort of a startup culture, and we haven't done much of those two things, but can we do more as a society, or should we be doing more? So, I'll ask both of you.
Yeah, so I would want just the public to really understand how these companies make money. So partly by reading, some of Matt's great reporting, but also just to get it. So, I think that there's a growing understanding amongst consumers that data is currency and that their data is currency, And I think people are just coming to a kind of awakening about that. But the different companies, the leading companies have different models. So the African Ancestry Company, which you mentioned, which, has a declared commitment to, it has a kind of civil rights kind of narrative that comes with it, we might say. Claims that they don't keep any of the samples or any of the data. They have no data, right? Apparently, like we have no way to verify that, but they have no data, which means that their tests cost a little bit more. Their tests are about $350 a piece, or so to do both, there's $700, right? A company like Ancestry.com has a subscription model, right? So those of you like me who use Ancestry, if you don't renew your subscription after 12 months, you're like locked out of your family tree, you're locked out of your markers and the things. And so, so they charge a little bit less for their tests, but they have a model that's going to keep people paying over time. And then we know 23andMe has, a recipe that's about having partnerships with pharma. So all of those, I think, pose different risks or opportunities or things that consumers should know, and I think that people should know that. So on the one hand, literacy means a kind of science literacy, but it also means a kind of market literacy about what value your data has to each company. And that's not only for direct-to-consumer testing, it's for other things as well. I certainly think that we need some sort of, I liked Matt's use of the word guardrails. I mean, we do need to, regulation has become, a dirty word in some places, but we do need some kind of regulation. Because, you can't disrupt everything all over the place and sort of leave individual consumers to deal with the potential downsides of these technologies. At the same time, I think that we really need to be a lot more agile in how we think about what regulation is and how we think about, for things, for example, we've got significant bioethics rules and regulations in a health setting, right? But if you're talking about ancestry testing, there are these same bioethical regulations don't, it's like this isn't medical, so these regulations don't apply. So when we're thinking about data, I think we need to move to a model that travels across sectors, right? That's not like we have this regulation for healthcare data and this regulations for other kinds of data, because these data move through the social world. So that would be my suggestion.
What do you think, Matt? Do we need guardrails?
Oh, well, yes. I mean, look, I've spent a lot of my time has always been covering the pharmaceutical industry. You do not want a pharmaceutical industry that is not heavily regulated. You want them to have to prove that the medicine works and is safe. And the more they have to do to prove that medicine works and is safe, the more likely you are to find out that it does something really great. So you can do too much and make it so no one can ever bring anything to market, but we don't want people getting cancer drugs that are ineffective. Mm-hmm. And you can only know if they're effective by doing big studies to prove that they are effective. I think that in the healthcare sector for genetics, I don't think we're in a world where there are a lot of privacy breaches going on, where these data are not protected. I actually do think that people tend to be fairly well protected. I don't think this is a huge problem right now, because these companies are regulated. Some of the problems are the opposite. I mean, there have been the issues in research studies of DNA sequencing, where I've heard the complaint from researchers that some of the regulations say that because of the way patients are consented, you can't recontact them. So you find out that somebody has some terrible risky mutation and you can't tell them. Figuring out those issues of reconsent is, there's the risk of you don't want to know stuff you don't want to know, and there's also the risk of, well, maybe there's something you really want to know. And it's very hard to come up with a set of rules that always works. But I do think that we certainly need a lot of regulation of it because there are a lot of risks and because privacy is very important to people.
Mm-hmm.